take the tentative agreement back to members for a ratification vote, but we will talk about that during the press conference.
And we won't have detail, but we'll be doing a lot of hinting, I would say.
Yeah. And here, this is a really good hint right here.
Yeah.
Yeah, for sure.
Is everybody ready? Yeah. 1 second. Everybody who's sitting in the gallery, can you turn your phones on silent for me?
Mine's over there
You gonna
somewhere.
put it here, or?
Where?
Right, Tosh, you want to just turn my ringer off? On the side, the other side. Yep.
Look at me. I just meant for the picture. Okay.
Is anybody live?
Channel
Left
2.
side, I think most of it.
Okay. All right, I want to thank everybody for coming. As you know, last evening we broke news that union members, more than 6,300 union members at Kaleida Health were able to reach a 3-year tentative agreement after intense negotiations across the weekend, some 17-hour days. And so today we would just like to make additional announcements. I'll give you the president of CWA Local 1168 and the vice president for 1199 SEIU.
Good. Good afternoon, everybody. Thank you for coming. We reached a tentative agreement with Kaleida Health and our 6,300 employees last night about 12:30 in the morning after an intense weekend of negotiations. I believe we negotiated an historic agreement here that will put us in a position to recruit and retain healthcare workers of all job titles, registered nurses, PCAs, certified medical assistants, no concessions. We had a platform that we were going by, as you can see here, with our priorities: increase in pension, staffing, no concessions, wages and benefits, respect and dignity, and we reached every single one of those goals.
And I'd like to add that, again, a long, lengthy amount of time and hours put into over this weekend. I think Friday night was a 14-hour day, 16-hour day. Same thing with Saturday, and then we, again, like Corey said, we finished up late last night, early this morning on the agreement. This is definitely a historic agreement. This is my 5th. I know Corey's has done more of the Kaleida contracts than I have, but for me, this is definitely the best contract that we are going to be bringing back to our members. This is going to, definitely lead the way in what healthcare is hopefully going to be based on moving forward. We're going to see hopefully be able to pull new people into the system. We have a lot of openings that were current prior to going into bargaining. We were able to negotiate over 500 new positions in this agreement, so it definitely is a historic agreement. We needed a lot of help through the process with this. I can't say enough about our bargaining committee. There were 50 of us that sat in this room for months. We've been here since March, and had great days, had some knockout dragouts and arguments and everything that can possibly happen at the bargaining table. And again, everybody stayed focused, everybody stayed together, which was great. It was great to see within our two organizations that our two political departments, really out of New York, work closely together with our local electeds. Can't say enough about the help that they provided. Mark Polenkars, Sean Ryan, Tim Kennedy, Crystal Peoples, again, constantly on the phone with us, constantly what's going on, how can we help, and Governor Hochul, the governor, always kept, an eye on things here. It was important for her to see this contract come to a positive conclusion. And again, with the help and a lot of the calls and just everybody working together, I think we put together a historic agreement. So.
I just want to jump in. I'd like to definitely absolutely applaud this bargaining committee. We all pushed each other to breaking points, but we knew who we had to report back to, and we always said our board of directors are our members, and there's thousands of them. So, and I'd like to thank our mobilizing and organizing teams, which are made up of our members, who have pounded the pavement for months now, organizing and mobilizing our members. The members won this contract. I mean, we always say that we're pretty good at what we do at the bargaining table, but it is our mobilizers and our members who push it over the edge. So.
And then I would say, before we start answering questions, I think one last thanks, and it has to kind of go out to a person that has always been there for both organizations. She is, she is the leader. The district with CWA. I mean, I can't say enough about Debbie Hayes and what Debbie Hayes has done for this contract. I mean, Debbie's time goes back to when they had the strike at Buffalo General back in the 80s. And I think that legacy and what we've done moving forward, Debbie sits in this room, and if you didn't know her, you didn't know what organization she represents. She argues as hard for the nurses at Children's that she doesn't represent to the members that she does represent. And again, and she's really the leader at this table, and I'll say that. And there are a lot of leaders, but Debbie can't say enough about the work that she's done, and the work that everybody's done over the last period of time. Think about what's happened in a 1-year period. 2 days ago, a year ago, the strike at South Buffalo Mercy took place, which kind of set the stage on what was going to happen, and the hard work that was done over there translated over here and helped what we did here. Because even Kaleida, going into this contract, wanted to come out of this contract being the best paid, best benefit employer of choice, and we've achieved that together. So I gotta also give credit to a very professional working relationship we've had with Kaleida, even though they've had some leadership changes. I think the direction that the hospital is going in under the new leadership, I think is gonna be fruitful, and a good working relationship with us and with them. So anything else with that? I think we can take questions.
Okay, how much did the $25 million from Hochul last week, how much of a difference did that make in this thing finally winding up?
My answer to that would be, you'd have to ask Kaleida that. They're the ones that are, in the end, the ones putting the money on the table that we negotiated. So that I don't know. I'm sure it wasn't nothing. Not only the $25 million that was received, what a lot of hard work from our political departments every day working and making calls. But then also hopefully future money that we're all going to work on together. Kaleida, the two unions are going to work on to try to get into the next budget schedule and moving forward.
I also think that the recruitment, to be able to recruit and retain and put enough healthcare workers at the bedside, is also then going to change revenue for us, right? Because you're going to have less falls and less complications, extended stays in the hospital, and those type of things. Think of that end up generating a little bit, definitely more revenue, because reimbursements are based on kind of bundles, and if people end up with a fall, that's all on the facilities to continue to pay. So that's always been our push, at least for staffing for the last 20 years, is that it might be upfront money that you have to do to recruit and hire a bunch of a lot more nurses and support positions, but at the end you'll benefit from it.
And I also want to add that the work, again, politically that we've done, and the help that we receive from, again, I can't say enough about the local delegation. This is a drum that we are going to be pounding in Western New York, in upstate New York, is funding for our hospitals and our nursing homes and our community are lacking, and we are going to continue to work hard to change that. I mean, that's where we have to go. It can't be this patchwork kind of operation of healthcare. You know, the state gives money to the ones that can't make payroll. You know, can't that the operations are in jeopardy. That type of system has to stop. You know, so changing how hospitals and nursing homes and just healthcare institutions in our community, that needs to change moving forward, and we're gonna continue to work on that.
Next question.
As far as the next steps, I know you mentioned in the press release a little bit, Kaleida talked about it. Where is this heading, and as far as union membership is concerned, do you expect this to be ratified?
Yes, the bargaining committee is recommending this contract. We're gonna work, hard to get this contract ratified, which is making sure our members understand all the details that are in this contract. We were talking about, we were going through tentative agreements that we reached 3 months ago, and we were going, oh, I forgot we did this. Oh my God, it's like we achieved this. And so the plan is, after this, is we're gonna sit with Kaleida and do some final signatures on papers. And we have teams of people that are working to do a kind of like a face sheet of the big highlights on the agreement and get that to our members sometime today. And then our members will have access to all our tentative agreements to view and schedule a ratification vote date. So hopefully within the next couple of weeks, we should have this contract ratified.
Well, I guess kind of going after that, Corey and Jim, I know throughout all negotiations, you guys have really remained firm that Kaleida's previous proposals wouldn't get ratified, by the members. What makes you guys confident that this tentative agreement will be able to kind of move forward?
We reached all our goals. Our members created this platform through our surveys, us walking the halls, talking, having meetings, and we created this platform, and that's why it was just so easy to keep, especially over the last couple weeks after the strike vote, where we could just keep looking at that list and knowing that we reached those goals. And, so I'm confident it will be ratified. Is every member everybody's going to look and say, what did I get? And is every single member going to be like, whoa, this is the best thing ever? No, I haven't bargained an agreement that 100% of my members were thrilled with, but this is a historic contract. I have never bargained a contract like this.
And talking about our platform and what's on the list below us, some of those that are on that list, we did not achieve until about 1 o'clock last night. So, once again, all of those were achieved, and many others. I think we have well over 120, 130 tentative agreements within this contract. And again, it's the driving force of our members and this committee. Our goal was always to get an agreement. Our goal was never to go on strike. And Kaleida heard that. People in the community heard that. Our local leaders all heard that, because we were in constant contact with them, having meetings with them. And again, I think it's, putting this agreement together will hopefully and fundamentally change healthcare in our area, and hopefully now drive other healthcare institutions to, step up and do the right things for their employees and our members, because we represent, between the two organizations, good 80% of healthcare workers in the community.
Corey,
Next question.
same question I asked you a year ago. Where are the nurses going to come from?
I think that, it's lining with schools, referrals from our own employees to, and the scary part is that people will start kind of poaching from other hospitals.
Yeah.
It has created this competition between all the hospitals to get people in. My thing is we have to give a reason for people to go into healthcare, and we have not seen a lot of people going into healthcare, especially with the registered nurses, in a very long time. The conditions are harsh, they're hard, they're long hours, we work holidays, we work weekends, we take on call, and you know, it's a tough job, but I think raising the wages and the benefits will give people an opportunity to say, yeah, I can do this, so.
And I also want to just add that as we talk to people in the community, and I know me and Corey have talked about this for a while, you know, we have to get into the high schools. We got to figure out a way that the unions with the employers get into the high schools and they explain to our the youth that are coming up through our organization or through the community that, you know, when you say about getting into healthcare and you have people saying, I don't want to be a nurse. There are so many job titles. I mean, God, if we can tell you how many job titles that we've talked through in this contract, and they're great jobs. I mean, they're really fulfilling jobs that are within the healthcare industry. And I think once that can be explained and understood, and on top of that, you know, being within our contract, the Kaleida contract, we have a training fund, you know, the organizations that we run that, you know, can put members to school. I mean, we have members that were housekeepers that are now nurse practitioners. They've gone to school for free, you know. So again, that's a vehicle that Kaleida has. Some of our other employers have, and some don't. And I think Kaleida, you know, needs to use that as a recruiting tool. And it's been good over the years. We've sent a lot of people to school, and a lot of people continue to be in school.
John?
How many years?
The agreement, it's a 3-year agreement.
And when does it start?
It's retro back to May 31st
June
of this
1st, June
1st
1st,
of this year.
yeah.
Yeah.
So June 25?
Yeah.
Yeah, John?
I was just gonna ask, do you guys think you were ever close to issuing a 10-day notice, or was there a moment where you started to get some momentum toward a deal?
There was always a time, I think, that it could have been issued. There's no doubt. I think the momentum shifted Thursday, Friday, around there.
Yeah, more like Sunday.
Well, in the end, yeah.
It was, I mean, we
Yeah.
still had no concessions, improvement in pension and wages still on the table until midnight last night,
Mhm.
so.
Was there a single issue that you kept coming back to, trying to work this out?
Staffing. Yeah. And again, as we say, historic, you know, within the agreement that we put in place, we've created over 500 new positions on top of what's already open. And hopefully the staffing proposal and with the staffing legislation that was passed last year, we are going to put in position our members to work in safer conditions, not working, you know, where they're taking care of 8, 10 patients, where they should be really taking care of 4 and 5 patients. The aides and ancillary staff not taking care of 30 patients, but getting back to a rate of 6 to 8 patients, and that's all stuff that is within this agreement. So that's when we say it's historic. You know, we've got a state law behind us now where we can track it. We've added positions to the contract where we're going to have people doing staffing and watching how staffing is being done within the facilities. Full-time positions that's been created in this contract. So we have a lot of positive within this new agreement.
And I think that a part of the staffing incentive plan that we put together, and without giving specifics, it's got good dollar amounts in there. And where there's a lot of agency, the goal is to, with these staffing incentives, to almost get those people that are picking up extra time very close to the agency wages, because that's always been a bone of contention with us, is that we have these strangers that come in and they're making a lot of money. And so it's definitely, you're going to see the ability for our members to make some really good money by signing up for extra shifts and doing that. And hopefully as they start to do that, you'll start seeing, and we start recruiting and hiring, you'll see the agency kind of starting to leave, because we still have like over, I don't know, I think it's close to 350 travelers in the building. So a lot of work ahead of us. We have to work closely with Kaleida. We're committed to do that on recruitment and retention, and really getting out to the high schools and the colleges, and hopefully we'll get our members to the point where they're going to be saying, yeah, you need to come to work at Kaleida Health.
Schools basically pretty much ran last year. This year started as normal as a school does. Are you going to see people who've been out of the job market because they had to be with their kids at home coming back into the market because you know, the kids are gonna go every day.
Yeah, I mean, that there's a lot of, at least with the registered nurses, there's a lot of people that hold New York State licenses that are not practicing. So we're hoping with better working conditions and lower, I have a dear friend who is thinking about actually coming back to the hospital, and she's like, when you talk to her about it a couple of years ago, she's like, I'm not coming in and taking care of 10 patients. Are you out of your mind? But those are the people that we might draw back into the workforce. And we've been very creative in this contract to do short shifts where people who have retired may want to come back and do a couple short shifts a week, and that we're able to hire them at the rate when they left. Because before, if you had left and come back, you're kind of start back towards the beginning of the scale. So we did a lot of creative stuff in the contract to try to address that issue that you raised, which is, I always said, they're not going to fall from the sky.
And also, you got to look at where our members were at the time. We had members leaving the field because of uncertainty. When the pandemic hit and we were on the phone hours every day and in contact with all of our institutions, and people are leaving. We have people saying, I have a husband at home who's compromised with cancer. I can't take the chance of bringing something home. And if you think about the work that healthcare workers do, we all go to work every day. I go to work, you work in your newsroom, we work in our offices, and get the job done at the end of the day. I'm not worried about, okay, what am I taking home? Our members go into the fire, if you want to say, where COVID was rampant at the beginning, and not knowing what I'm taking home to my family. Some of the stories that we've heard from our members, where I go home and I take, I change my clothes in the garage. I wipe myself down before I walk in the house. That was normal for our members. And for some, they had to do, they had to get out of the field for personal reasons. I don't think anybody said, I'm out of here, I'm afraid. Everybody walked through those doors every day at all of our institutions, hospitals and nursing homes, to take care of the patients in this community. So, I think a lot goes out to healthcare workers here in our community and across the country that did that every day, not knowing really what we know today and where the pandemic is today. They walked in every day thinking, I can take this home and give it to anybody within my family. So.
More specifically, what will your recruitment efforts look like, especially given all the positions that you just negotiated and given, what you're kind of dealing with right now with staffing shortages?
Well, that's the increase in wages.
Mm-hmm.
We have a great health insurance plan. That's, our cost sharing is low on that. The staffing ratios, just trying to recruit's going to take a lot of work from all of us to get out there and start trying to pull people in. There's other holes in the system. We don't have enough clinical educators, for the schools. So there's only certain class sizes that can happen. We got to start addressing that issue. We have to start aligning with schools.
Mm-hmm.
We started a student nurse job where they can come in and do an internship for the summer, and they come in hoping then they get acquainted with the hospital and they start making friends and say, hey, maybe this is where I want to work when I graduate next year. So we're doing those kind of things, and we got to sit and brainstorm some other options that we have to get people into the system.
Yeah, I think if we look at other opportunities that we have within the community and how we can staff the hospital, I know we have a pilot program going over at Buffalo General for LPNs. We've taken LPNs out of most of the hospital systems, other than clinics and nursing homes. LPNs have really not held positions within the hospitals in a few years. So we're looking at pilot programs on how can we bring LPNs in to do a lot of the work and complement the RNs in doing the work. So hopefully that'll end up helping to stretch the staff, getting the numbers and the ratios down. But like Corey said, and both organizations are committed to working with Kaleida to brainstorm all this. We already got committees set up, or we're ready to hit the ground running as soon as we hopefully get this ratified in the next few weeks.
Before we move on to talking with a few workers, let's talk about the job titles that are covered here in the tentative agreement and the work sites.
I mean, the job titles, there's
I mean, yeah.
It's
I mean,
hundreds of job titles. I mean, April will list them all off for you after we're done. But the sites are, Buffalo General, Gates Vascular, I say Children's Hospital, but Oshai Children's Hospital, Miller Fillmore Suburban, DeGraff Medical Park, High Point on Michigan, numerous clinics, business office at Larkin. We have a wide range of the labs at Flint Road. There's, and I'm sure I'm missing some, but there's a wide range of facilities that Kaleida touches. So
And
a lot
lots of job titles.
Yeah, lots of job titles.
Do you guys think you met or exceeded the contract last fall at Catholic Health?
Well, you know that better than I do. You know the Catholic Health contract.
Yeah, I mean, we're going to be ahead of them in wages and definitely benefits. No, definitely benefits and wages. The ratios that we obtained in the contract are, maybe better in some areas than the Catholics, and maybe the Catholics have us in an area but it's by tiny bit, just a tiny bit. I mean, I'm very proud of this agreement.
Yeah.
You touched a little bit on the pandemic and the difficulties that healthcare workers faced. How much do you think that impact the last few years have had on workers, unions, saying, we're not going to settle for something that we don't think is up to standard?
That was, I think, a big driving force in this agreement. I think we said from the beginning that this is, and Corey's been saying it, for a long time, this is going to be a contract like no others. Like I said, this is my fifth. This is definitely, I think, the best contract that we've ever done. But I even still think leaving last night, it was kind of like, maybe because it was so long, you don't process that through until, again, you start going through things. But it's hard, and I think people that live what they lived through the pandemic, there's still a lot of scars. And I think, hopefully, this contract, and once it's ratified, we're not gonna snap our fingers and all the ills of, no pun intended, of the hospitals are gonna go away. It's something we have to work towards. We've set staffing goals, and there's a state mandate of January 1, and we know the numbers aren't gonna be there, but working towards those numbers are what we're gonna continuously do, is get to the numbers where we end up hitting those goals and we're moving in the right direction. It's gonna take time. It's gonna take a lot of time. But again, this is a long process, not an overnight success.
Okay, we're gonna have some workers come up now to talk.
Okay. Thanks, everybody.
Thank you.
Charles, Kim. I'll get you one more. Can you scoot down?
Oh, yeah, we can scoot together. Come on.
Oh,
Got enough? Okay.
yeah.
If you could have them start by saying and spelling their names and their titles, that'd be great.
I want you to look. Hold on one second. Right here.
And when you get a lot of sleep.
No, I know.
You know?
We're not at our best.
We're not at our best.
Or do you like?
No, it's okay.
From the left.
Hi. My name is Janine, Johne. My last name's Gonzalez, Gunsalus.
My name's Kimberly Kornowski, Kimberly Kornowski.
My name is Charles Williams. I am a patient care assistant and the vice chair at Buffalo General Medical Center.
Oh, your titles, did you go into your
Sure.
titles?
I'm a registered nurse, and I'm also the area vice president for CWA for the Millard Fillmore Bargaining Unit.
I'm a registered nurse at Oshai Children's Hospital in the neonatal ICU, and I'm the chairperson of the RN-LPN bargaining unit for 1199.
And finally,
Hi, I'm Latausia, last name Johnson, Johnsson. I am the chair of the Service and Maintenance Group at OCH Hospital, and I work in the recovery room ambulatory surgery.
whoever wants to start. How do you feel about this agreement?
I am excited. I'm pretty excited. I'm excited to bring it back to the members. I think that I'm very proud of the work that we did here. I think I'm proud of the work that's going to go forward for the community as well. We have fought long and hard to have ratios in the hospitals, to be able to give good patient care, and to be, proud to walk out their door and say we did the best job we could. And I think that we created the stepping stone to get there. And I think that I can't wait for the members to see the work we've done. We've worked so hard on it. It's been a long, long 6 months.
Was there something, just one quick question, was there something specific in the contract for your situation?
Staffing, over and over. Staffing and dignity and respect, they go hand in hand. You gotta go in and you gotta do a job, and you gotta be respected and understand that the tools that you need to do that job, if you're unwilling to give it, then there's a problem. I feel like we're now at the point where we have something that they're listening, and they came to terms with some stuff.
Give us 1 second. We're gonna bring one other worker in. Who I didn't see sitting there. We just wanna make sure we have a balance of speakers from each union. I apologize.
So
Curtis?
go ahead and give your name, your title, and the spelling of your name and your title.
Curtis Payne, Curtispayne. I'm a physical therapist at Buffalo General and Area Vice President for the Professional Bargaining Units for CWA 1168.
Thank you. Next question.
What do you have in this contract that you just didn't have it before?
Staffing. Staffing. The staffing is a huge thing that we needed in the hospitals to give safe patient care. We needed staff to provide for our patients, and now we're gonna get that.
How much easier do you think this contract, if it is ratified, will make your jobs?
I don't think it will make our jobs easy. It will help lighten the load. We all go in there, every bargaining unit, and we give it 100 every day that we show up. So it will actually help ease a little bit of it, but know that we're still united in doing the best that we can for our patients. So just because we did the contract and it is paper, we are as a people still are going to do the best that we can. We're still going to give 110 every day that we show up for our people. And as Jimna was stating, this part is just the beginning of it. Like Kim and Corey said, we still are going to stay united, still fight to get more staffing, still fight to keep the dignity and respect as Kim spoke on, and go from there. So it's going to help. It's going to help, but we still have a lot more work that we all together are still going to have to continue to do.
And to piggyback on what Tasha just said, to answer your question, from how I see it, it's going to help tremendously, because going from a one PCA, one patient care assistant, to a 30-patient assignment, to a one patient care assistant to a 6 to 8 assignment, it's a big difference. It'll require us more patient care assistants on the floor to be able to take care of the patients and keep them safe, and to keep their hospital stay very short and let them get in and get out, which will save money for the hospital. So it's a tremendous help that the ratios are coming into play. And the thing that really touched me the most in regards to this contract is the dignity and the respect, because we didn't feel like we were being heard. We didn't feel like we were part of this thing. They say we're family, we're all one family, but we didn't feel that. We weren't being treated like that. And they heard us. They actually heard us. And so that was the biggest one for me.
Next question. Any others?
I'm sure you guys all got into this because you care about people, and you kind of hit on it a little bit, but what is this really going to mean for those patients who you guys deal with on a day-to-day basis?
The framework's there. So now it's just getting people in the door, and with what we negotiated at the table, they're going to want to come. That's what we needed to do. We needed them to want to come and work for Kaleida. I wanted them to come in and feel like they're safe when they're working, and I feel like we've done a good job, and I'm really proud, and I'm very happy I'm union.
And for the patients, we believe, like they said, with the staffing, and she said the framework is set. The patients now can know for sure, like, they did this. Like, I can take my child from either Children's Hospital and know that I'm gonna get into whatever procedure or ER, I'm gonna get in, we're gonna get through, and we're not gonna spend 8 hours there. The adult facilities, I know we're gonna get in, they have the staff to take care of us, my mother and father are gonna feel well-loved and taken care of, and we're gonna have the time now to spend, to listen to the patients and not feel like an assembly line. So they're gonna come in knowing when they step foot in the door, everybody in there is gonna listen and care about every need of their family member, patient, and whoever else that comes through, so.
Yeah,
Absolutely.
Rome wasn't built in a day.
Okay, I think that does it, unless anybody has anything else that they would like to add about how you're feeling about this tremendous historic
It's
victory.
historic.
As a bargaining committee member, I am going to recommend this contract to my members. Say
Absolutely.
yes.
Absolutely.
Absolutely.
Historic
Absolutely.
moment.
We
It
worked
was an
very
historic
hard.
moment. A lot of team building, a lot of friendships was made, a lot of unity was made,
Lot of
a
fights.
lot of knowledge. Even though we were like one big dysfunctional family in here, at the end of the day, we always here for the same purpose. We learn from each other, we're building off each other, and we're gonna continue to just keep growing together, to make sure that what we started in here is gonna be seen all the way through.
That's what makes us strong.
Yep.
That's right, you're good.
Yeah.
All right, is everybody good?
Thank you,
Do we have
guys.
enough footage? Thank you. Tasha, hang around in case we need it.
I did a little bit of this